Hi guys, good afternoon. I welcome you all to Nostella's page. So, how is your day? I believe your day is good, successful, and productive because mine is also good. So, today I brought to you very interesting topic that I want us to discuss. I would like us to discuss on this particular topic because it's very interesting and educative. So, I will urge every one of you to pay attention to this particular topic that I came with today, and I believe you're going to learn something very important. Please, I will also like you all to please like, share, and comment on this my topic to also support me. So today we are going to talk on a topic which says infertility. I know many of us are too familiar to this particular topic that I brought today, but there are some things that you may not know concerning infertility. Yes, there are a lot of things in infertility that you may not know. Many people think infertility is all about not giving birth, but it's beyond that. So let's go there. Infertility is a situation whereby a woman, or let me use the word couples, are unable to conceive after a year or more years of uh, unprotected sex. This is when couples, after getting married for a year or more than, they were unable to produce their own offspring. That is infertility. Maybe something hinders them from giving birth or having their own children. That is infertility. So in this infertility, uh, we have about two types of infertility. We have primary infertility, and we also have a secondary infertility. Sorry. So primary infertility is a kind of infertility whereby the couples are unable to produce their own uh, children, maybe after a year or more years of unprotected sex. There is no sign of pregnancy. They are unable to produce their own children. They don't have any sign. They have not produced at all. But that of secondary infertility, maybe they have produced maybe one, or the woman have experienced pregnancy, but maybe she's having issues, but she have produced maybe one. So there's a sign of pregnancy before, but this person is still facing infertility issue, but you have experienced pregnancy. That is secondary infertility. So now let's go to the causes of infertility. In this infertility, we're gonna look at the both side, both male and female. Yes. Before I go to the causes of infertility, there's something I want us to understand. Many men, even not only men, people believe that it's only the females that have this issue of infertility. No, there's the capital no. So listen very carefully. Infertility can occur in men and women. Yes, it's not only the females that experiences these infertility issues. It can also result from the men's side. But people believe that, especially men, when they marry and their wife are unable to maybe are unable to conceive, they will look at the woman that she's the cause of the whole issues. She's the reason why they were unable to have their own children. No, sometimes the problem might be from the man. Yes, so that's why it's a very important this in topic. I told you that you're going to learn a lot. So sometimes it comes from the both sides. So you have to. Is when you do tests, you know exactly where the problem is from. Sometimes people will say is witches and wizard, or maybe their village people is the one causing the problem for them, but actually it's not. Yes, due to technological advancements, people are making research concerning health, the things that can cause some health challenges. So that's why if you go to hospital and tell doctor that is your village people or one witches and wizard in your yard or whatsoever that is causing you from being pregnant, they will tell you that is a lie. You should go and run test. Do you understand? Because of technology advancements. So now let's look at the female causes of infertility. That is the causes of infertility in female. There are a lot of things that can cause infertility in female, but let me just lead them one after the other. I'm going to explain them. We have what we call abnormal menstruation. Abnormal menstruation, I mean here is, women, the normal range of menstruation in women is 21 day cycle to 35 day cycle. Anything that as in exceed this range number I gave is abnormal. If a woman is having below 21 day cycle, that person is abnormal. If a woman is having 35 day cycle, is anything above 35 day cycle is abnormal. The woman is not okay. She should go and check herself very well and know where the problem is from. So abnormal menstruation is a problem of infertility. And when you are having abnormal menstruation, it will affect your ovulation. The woman cannot be able to track the right ovulation period. Yes, that's why it's a problem. The woman cannot be able to target the rightful time for her to conceive. There's something we call fallopian tube blockage. Yes, in women. Fallopian tube is one of the reproductive organ in women. That is where the sperm will flow and go to the ovary to fertilize the egg, which is the ovum. So when this fallopian tube is blocked, if there is any obstruction on the fallopian tube, it causes this infertility issue in women. Yes, it's a problem of infertility in women. So a woman supposed to, that's why you cannot just say that you're having this issue if you don't go for a test. You have to go for test, go for checkup to know exactly the one you are facing at the moment. There's another thing we call PID. PID is pelvic inflammatory disease. It's sexually transmitted disease. When a woman is having a kind of bacterial infection, a woman gets it through sexual contact. Yes, it's gotten through the sexual contact. So when you get this particular infection, maybe from your fellow counterparts, or maybe you got it from nobody knows, but if you have this particular infection in you as a woman, have it in mind that it's going to prevent you from conceiving. Yes. There's another one we call pituitary gland disorder. Pituitary gland disorder is a hormonal disorder. That's why we do advise women to go for hormonal imbalance test. You go for hormonal profile test, sorry. So when you go for hormonal profile test, you know if there is any issue in your hormone. There are hormones that are responsible for egg preparation, that is egg development, ovulation, and all that. We have something we call follicle stimulating hormone. We have lutein hormone. All these hormones, this follicle stimulating hormone is a hormone that helps to develop there is a follicle in your there is a follicle within the ovary. This follicle stimulating hormone is going to develop the follicle, make it to develop to egg. It's going to stimulate it to develop to egg. So this egg will now wait for the sperm to come and fertilize it. So when all these hormones, we have estrogen hormone, we have progesterone, when all these hormones are having issues, if it's not well balanced, the person cannot be able to conceive. Yes. There's another one we call ovarian cyst. Ovarian cyst is a fluid-filled sac in the ovary. is a fluid-filled sac surrounding the ovary. It prevents the sperm from entering to fertilize the egg. This will prevent a woman from conceiving. It's a big problem to women. Then we have also what we call endometriosis. Endometriosis is a tissue similar to the lining of the tissue in the uterus that grows outside the uterus where it's not supposed to grow. And this is what? A problem, a challenge. All these are causes of infertility in female.